speaker, who is Kimberly Mozingo, who is a registered nurse at NurseWorks Northwest. Kimberly, thank you so much for joining us today. We are really looking forward to your presentation. Please go ahead and take the floor.
Good morning. I appreciate that. Brett, your speaking presentation voice is so fantastic. I think I'm going to have difficulty following it. And I'm still kind of reeling from Cassidy's data results. They're applicable to what I'm about to talk about today. So I'll share my screen real quick and then we'll move forward. Please tell me if you have trouble seeing this. I'm on a long screen. And then also I have a tendency to talk fast. So somebody please say something if in fact I'm speaking faster than the audience is prepared for. So anyway, what to do? Good day. Thank you, SMART and Approach Management, for the invitation. My name is Kimberly Mozingo. I am the Chief Operating Officer at NurseWorks Northwest. I'm also a working nurse case manager. Additionally, in the event I may look familiar, I've recently had the honor of serving on Washington Self-Insurers Association board as their medical representative for the last 2.5 years. So today's talk comes from various vantage points of experience within workers' compensation and the community. Not only that, but fun fact about me, I too did time in the industry of labor as a construction mechanic way back when. Yep, that's right, US Navy CV. So the can-do spirit that you're about to hear from me comes deeply ingrained. So today, more so than what NurseWorks Northwest specifically can provide for you, I'd like to offer a glimpse into the world of nurse case management as a discipline, regardless of the firm that you choose. So I'm about to share a few industry trends, impacts, and utilization of the nurse case management. And if time permits, I'm happy to open discussion at the end of my presentation. So we might as well get started. I am sure all of you
Kim,
know.
Before
Yes.
you go on, can you make your screen bigger? It's really small.
See, yes, and this is going to require a little finesse because I'm on a, it's on a turned screen. So
okay.
This may
we
take.
can't read it.
That's okay. Let's see. Watch. We'll just see what happens real quick.
Okay.
This is the effort of the day, is working through these. So let's just talk to my monitors. And that's the beauty of display settings. Thank you for sharing, because I test this monthly with my staff and they've never once told me they had a problem seeing it. So let's just get back to basics here real quick.
Okay.
Identify. Lower left corner, you say.
Tony, you had mentioned that lower left corner, you can expand it. Tony, can you elaborate on that? I'm trying to find it for her, or maybe she can find it on her end. Anthony?
Yeah, it's right down by, it's not for her, it's for the participants. In the lower left-hand corner, it should say her name and her title, and then it should have a minus and a plus, and you can actually zoom her screen. I'm at plus 200 and can see it pretty well.
Oh, Tony's lifesaver, because my identifications are not behaving.
At least on my Microsoft Teams app.
Yeah. Okay, there you go. So thanks, Tony. If everybody wants to look down into the lower left corner of their screen, there's a plus and minus. And if you hit plus probably 5 or 6 times, it's going to increase Kim's presentation, and that will be very helpful. So you will have to manually do that, and you'll get a better glimpse. Thank you, Tony. You're the man.
Saved by the Tony.
No worries.
All right, moving on. For those of you who know labor and industries, labor and nurses seem to gravitate towards one another. Personally, I always thought about nursing as an extension of mechanics, right? Preventive maintenance to start, line tracing, parts repair and replacement, finding value and keeping the old models in tip-top condition. You get it. So for what you do know about nurses, what do we know about a nurse case manager? At the base level, it's a registered nurse that oftentimes requires further credentialing through various accrediting agencies to signify professional competence specific to our scope of practice. Nurse case management encompasses the medical scrutiny that impacts one's health, physical, psychosocial, family dynamics, the limitations and restrictions, access to resources. And then it coordinates the clinical side of recovery, understanding the diagnosis and the treatment, whether the claim is progressing the way it should. And throughout the course of the care, we are a consistent resource for the worker, the provider, and the claims manager, all of which might have different perspectives throughout the duration of the claim. The nurse case managers are generally retained by the claims adjudicator or claims manager when it's recognized that the claim needs more involved or acute coordination of care. The claims adjudicator owns the claims administration, benefits, liability, decision, and reserves, while our role facilitates the clinical picture. Neither of us replaces the other, and honestly, the claims process seems to work best when all parties are collaborating with the whole care team, consequently keeping the worker actively engaged in that recovery plan. I do want to clarify there are instances where the employer retains the nurse case manager directly, and so in this instance, the relay of information would be nurse case manager to employer, employer to the claims manager at L&I. Which can be a point of confusion because that's different than when the claims managers retain us. So nurse case managers sometimes are even brought on to a claim to sort care and support behind the scenes decisions, short-term actions, task assignments, right? Like helping find a provider, evaluating records, things that'll help bring confidence to treatment decisions. So what I figured I would do next is walk you through a visual representation of where nurse case management sits relative to care team coordination. So at the top left, we have the worker and family. And as a nurse, this is generally the most impactful relationship we might make. Fostering confidence and trust here really can change the impact and the outcome of a claim. Workers who feel valued and heard are more likely to remain engaged and motivated, resulting in a quicker return to work. And that's further backed up by a study by Santos in 2025, indicating that approximately 80% of workers return to work within 102 days or less. And of those workers who remain off work greater than 6 months, they are less likely to return to work. Shifting to the top right, your medical care team is your attending provider and specialists. And often these entities work in a silo, focusing their direct impact to the worker's care needs. And this is where nurse case management comes in to be able to globally review each provider's efforts to help the claim move forward. Now, interestingly enough, employees who take time off work for scheduled surgeries return significantly faster than those on a workers' compensation claim, even though the type of injury is generally similar, if not the same. Yet the treatment plan and the recovery expectations are significantly different. This is also where nurse case management can be an advocate to kind of help prevention of a lingering care. Now shifting over to the bottom right are adjunct providers or ancillary services. So PT, OT, pharmacy, durable medical equipment, behavioral health, massage, chiro, as those are needed. They have an impact to the claim, and it's imperative that these providers are very forthcoming and engaged with the goal of recovery, not perpetual care. Which takes us to the bottom left, which is the employer. And ultimately, this is the second most impactful element of success to return to work from my lived experience as case manager. A worker whose employer truly conveys invested and compassionate care and investment to their return to work makes a huge perceived value in that worker's opinion within the organization. So my recommendation would be to encourage employers to evaluate their return to work plans and see if you've got any can-do spirit within your control. This is also a place where nurse case managers can step in and evaluate restrictions and proposed modified duty if available that might be overlooked by the AP if they don't have access to knowing what's available. Fast shift, we're going to talk about some medical circumstances. And as claim progression, access to care, treatment decision, timelines, and guidelines are ever changing, L&I has been moving towards a language of medically appropriate care, which we're in hopes that greater consideration to individualized treatment might further expedite workers' access to recovery pathways. This is going to require patience and perseverance as medical dynamics continue to evolve. So we'll talk about 3 elements of care noted to impact recovery. These are silent partners generally overlooked in decision-making or not considered until the claim is well underway. They are mental health, comorbidities, and the aging workforce. So let's talk about them. Now, I will pause to say I would be remiss to not mandatory reflect on why mental safety is not to be overlooked, and the why is you. You all matter, your employees matter, and without each of us, we would not be here. Statistically, 56 of 100,000 male construction workers die by suicide every year. That is second only behind oil and gas and mining, which still is nearly double their rate at 32 per 100,000. And while 56 by 100,000 may seem difficult to wrap your head around, I've modified the scale to kind of help put it in perspective with this visual aid. That's 38. So the number really breaks down to 37.5, but this is 38, a representation of 38 13th men scattered throughout Lumen Field, based on a sold out ticket capacity of 67,000. And so for me, it really kind of helped bring it a little closer to home when you really can like see a visual impact, knowing we're going to lock eyes on these people, shake their hands, exchange pleasantries past them as we're walking by, or even know their friends and family. Workers injured on a job suffer multiple losses, not just their physical or reported injury. Most of us identify with our profession, our work ethic, our sense of purpose, contribution to society, communities, and most of all our families. And the impact of a work-related injury has a trickling effect. And so I really honestly believe that we can do better to overcome the stigma and reduce these numbers. Overall, today's workers' compensation claims are more medically complex than they were even 5 years ago, and individualized elements of one's medical status driving that complexity are not always what shows up immediately at the time of the incident as they're filling out that report of injury. Returning to the original discussion on statistical numbers, revisiting the impact of mental health. When mental health treatment on a claim is delayed rather than addressed early, that claim tends to run roughly 3 times longer than with early intervention. 3 times. Speaking not only to the impact of medical stability and return to work capacity, this is 3 times as long that a worker ruminates on their sense of ability versus disability, their sense of purpose, confidence, connection with their identity, perceived health status, and honestly, the future ability to work equitably next to their colleagues. Recognizing that one's mental health is not something that we should shun or hide or dismiss as problematic, but as an opportunity, as an early identification to access and overcome a barrier to recovery before the dwelling sets in. We really need to be working hard to rectify mental health as an overlooked until it's too late state. Meanwhile, we're encouraging workers to be forthcoming with their healthcare teams and allow conversations to paint a true picture. As nurses, we're clinically trained to pick up on tone, context, altered consistency, and action. And while it may be uncomfortable to talk about these things, the nurse might be your first and best access to finding the solutions you may need. Oftentimes, just as the physical recovery is noted to be resolved, the mental health concerns arise seemingly out of nowhere. And not to mention, in addition to the previously noted time delay impact, NCCI data actually shows that when a mental health component is added to a claim, it tends to run about 2.5 times more expensive than a claim without one. Now, I will say that the optimist in me is compelled to share that the time it takes for a worker to get a first treatment appointment has dropped nearly 50% since 2021, although that timeline comes with mitigating factors of why, I'm sure. In a time where it feels challenging to receive care and find providers, the statistic is indicating an improvement, possibly suggesting a shift in prioritization in early connection to care. Now we just need the outcomes to follow. The second impact to medical complexity would be comorbidities in general. And so for those of you pondering the concept of a comorbidity, or if you may have one, a comorbidity is simply another health condition that is established alongside of the injury. For example, not inclusive of diabetes, hypertension, obesity, or prior injury to the same area. These are just a few of the most common ones that nurse case managers come across when supporting claims. Comorbidities, while not profession specific, if present, do have a tendency to cluster to types of work. So think about it in terms of high impact versus sedentary work, outdoor versus indoor, mental intensity, high and low risk work, etc. This is a good reminder that while we are all grouped together in some capacities, ultimately we have our own individualized care needs. And according to the Healthy Systems 2025 Workers' Comp Industry Insights Report, 60% of participants in the report named comorbidities as the #1 barrier to recovery. So considering the cost impact, one comorbidity could roughly double the cost of a claim, while 2 or more could push it 5 times higher. Ultimately, comorbidities have a propensity to raise both medical and indemnity costs, as well as lengthen disability regardless of the worker's industry. Lastly, I'll talk about the aging workforce. This is a testament to the reality that we are all living and working longer, thus the resulting impact to acknowledging age as a demographic of consideration. There is a natural correlation of increased claim cost associated with age, whether that might be calculated time lost days, cost of recovery, and resulting return to work incomes. In part, this is due to those naturally occurring comorbidities that we acquire over our lifetimes. And in nurse case management, we are seeing an influx of workers beyond age 55 for work-related injuries. And we're halfway through that anticipated projection timeline that will pivot the number of workers 75 years or older projected to still be in the workforce by 2030, which they say is what's at 97%. This is fascinating to me. Anyone working well past the age of retirement deserves a great deal of respect for their contributions to society. Anticipating worker well past that age, it really gives us an opportunity to dive in and look at what is prudent for organizations to consider. How can we provide inclusion from a safe environmental perspective? By no means I'm suggesting to discriminate age against the work. It's just simply a call to action where applicable. Now I'd like to transition over to my hot topic, the elements, some of which we've already covered, on how nurse case management can benefit the claim and how nurse case management industry-wide and nationwide has proven to be an asset to claims management. Navy SEALs have a phrase, fast is slow and slow is smooth. Nurses have a phrase too, discharge starts at admission. So from the time a claim is open, everyone should be planning for claim closure as timely as possible. In 2025, you'll see here, URAC published survey results tied to case management referrals. Pertinent to the workers' compensation, they identified results correlating the time frame of referring nurse case management to a claim from the date of injury to return to work. Then they further separated telephonic versus field case management assignments. Interestingly, there was a noted slight increase in the return to outcomes within 90 days for field case management referrals assigned greater than 30 days from the injury versus a similar telephonic service referral. 7% on that graph looks visually significant if you find value in waiting 30 days before you invite a nurse case manager to your claim. However, when you scrutinize the data, you'll be able to articulate and calculate that 13% increase in a return to work outcome within 90 days for claims where the telephonic nurse case manager was brought on within 7 days of injury. Our work coordination of care comes with overcoming objections. Washington L&I is incredibly worker-centric and respectful of a worker's autonomy and decision-making. Therefore, nurse case managers have to be nimble and rigid in how they define their roles. Labeling telephonic versus field nurse case management criteria poses challenges to the expectations. Providers decline nurse case management participation. Workers have the right to decline our presence as well. Therefore, a strong nurse case manager will foster relationship, respect boundaries, and work with the whole care team to make sure that determinations are made of when it's appropriate to pursue presence at an appointment. Subsequently, a strong nurse case manager firm will take great pride in considering the fiscal responsibility of their work's impact to claim-related costs. So, for a variety of reasons, traveling to worker appointments and the risk of being turned away is not always the most efficient or cost-effective solution strategy. My recommendation is work with the nurse case manager and the worker to emphasize the needs-based support, foster the best plan that meets the worker's circumstances, not a rigid expectation for nurse participation. Now, having a clinical counterpart as the fulcrum for a complex claim management allows other parties to the claim to focus on other needed areas of their roles. Providers, whether it's attending providers, specialists, PT, OT, they have an abundance of patients to see, and they generally treat in the moment care. And they don't necessarily think ahead to the next step. Ideally, they're good historians and they're relying on their prior chart notes to help get them from appointment to appointment. But recognizing how their colleagues' decisions are impacting the claim is not of their concern, where nurse case management gets in an objective seat, where we can take a focused picture and coordinate industry care guidelines, authorize care decisions, and intuitively do so with a sense of urgency that may otherwise result in claim delays. The urgency brought forward from a nurse case manager is served by quick access to records, resulting in early identification of discrepancies, reduced gaps in claim management treatment decisions, and coordination of care. These time-sensitive elements are huge contributing factors to a worker's perceived value. Workers who do not feel valued or question if others feel that their care deserves urgency have a tendency to become disgruntled and less engaged in their recovery, which results in delayed return to work. It goes without saying, a worker's injury does not only affect the worker. Their absence at work has a compounding effect to the organization's operational objectives and costs, as their coworkers and the clients and commitments that the businesses serve. So ultimately, the whole community is impacted by a worker's injury, and I strongly feel that they are valued and their presence at work is missed. Similar to the phrase, use the right tool for the job, the concept applies to human-centered care as well. Use the right professional for the job. Now, complex conversations, I will say, are within the nurse's preferred communication style. You'll see here, there are scenarios and circumstances where nurse case managers will and will not flex our mental muscles related to claim care. We are trained critical thinkers. And the standard of our work lies in a core tendency of being able to identify a deviation from normal. This skill carries over into every aspect of our lives, both at home and at work. We are solutions-minded strategists, and safety is our top priority. And for those of you who may know a nurse, I am pretty confident you've experienced this sometimes without even knowing it. Honestly, everyone takes their job personally. It's the pride of ownership, right? And a job well done. Occupational fatigue is no different than caregiver fatigue. Pattern recognition, unfavorable outcomes, and impacts to our own objectives, in part due to the decisions by others, can wear on all of us. And it's so easy to make assumptions, draw conclusions, or make feelings-based decisions. The employers and claims managers are the closest to the claim, second only to the worker. All the more reason I am asking you, just send in your secret weapon, a nurse case manager. Let the trusted resource step in and reduce the mental burden with objectivity and fresh eyes and medically supported rationale. Our role gives leverage to a claim by seeking accountability by the whole medical care team. Do we run into limitations? Yes, we do. We're nurses, not magicians. We can engage in constructive or difficult conversations, but we can't direct medical care, and we'll continue to remain steadfast to our morals and nurse practice standards. But overall, the goal is to overcome someone's worst case scenario, which is a work-related injury. Now, deciding what's in it for you, where a nurse case manager fits into the claim is a decision only to be made by aligning both your care needs and the perceived contribution a nurse could bring to each claim. Nurse case management is not an obligated beginning to end service. It is a just-in-time service. Nurses are nimble, and a good firm can step in to meet your care needs and step out of your claim at your discretion as the goals are obtained and the need for additional support arises. So our invitation to your claim is not necessarily for the duration of the claim unless you so choose. So give yourselves permission to recognize when seeking help and solutions is not just about caring for that complex case, it's also about caring for yourselves. Early intervention speaks to itself from there. Setting transparency for the nurse's participation and alignment of the nurse's role can help shift the claim. We know you hired us for more than data gathering resources, and we are happy to show you that we are up for the challenge. So lean in, trust the process, because we do lead with the best of intentions and we will follow accordingly. Lastly, recognize where the right decision may not always be the one you want to hear or the one that we want to share, but it might be the right thing to consider based on the end goal. Now, having covered all of that, what's in it for you and me, the statistics, nurse, and scope, we made it to the end. If your interest is piqued or if you have questions now, you're welcome to take my contact information or reach out. Brian knows how to reach me as well. Email is the quickest and most direct access to reach me, but I will now leave this last 4 minutes for all of us. Thank you all so very much for having me.
Wonderful. Kimberly, we appreciate it. What questions do we have for Kimberly? Let me check the chat room here and see if any questions popped up here.
I hope to meet new friends. I did scroll through the invite list for this meeting and I was like, I don't see a lot of faces of names I know. So this might be an opportunity for the future, folks.
Absolutely. A great connection. If you have not taken down Kimberly's information, please do so. We will have this recorded and posted on our YouTube channel as well. If you would like to go back in and hear some of the details or share that with your team. Kimberly, we appreciate you attending today.